Welcome to Africa this week. I'm Abubakar Sadiq Ibrahim. I'm here with a pharmacist, a to medicine researcher into herbal medicine, pharmacist, Ben Amodu, my senior. Welcome to Africa this week.
Thank you very much. This is Dr. Ben Amodu of Halamin Hava, a researcher into communicable and non-communicable diseases.
Okay. Well, fine. You have already introduced yourself, and I appreciate that you are going to make my interview pretty easy for me. Because before I will introduce you, you have introduced. Ladies and gentlemen, you are watching Africa this week. The pharmacist Ben Amodu, a herbal, researcher into various diseases and sickness, of high calamity, phytomedicine researcher. Let me ask you, because you are dealing with people who are very deep researchers, very deep medical individuals, pharmacists. You guys have your own, terminologies. The way you speak, the way you address issues are different. So I'm going to ask you first, give us these definitions of, when you are referred to as a phytomedicine research. Give us the definitions. Let us in of what, a phytomedicine researcher is.
No, it's simple. From phyto is a Latin word for plant. Plant, we research into plant medicines, natural medicine, sort of.
Okay.
So, by phytomedicine, we mean medicine that come out of plant. And the plant could be food. It could be any plant in the forest. But more importantly, my researches are into plants that are eaten by human beings. So you can call them as food or plant or whatever name.
Okay. You have told us that. And that takes us that you're a pharmacist by training, by practice. I'm gonna take you into. I've heard you several times. We have not met since we left secondary school. This is the first time I've met you for several years. We were together. The last time I saw you was 1973. You were in Form 3. I think I was going to Form 3. You were going to we are going to Form 4. I left Seminole Secondary School, or grammar school, now secondary school. And I left for St. Peter's. And you guys were a year ahead of me. And I didn't know, even until from primary 3, that's a senior high, what we call Form 3 before. By the time you get to Form 4, you start is looking for what you are going to study, who you are going to be in the future. Were you going to know that you were going to be a pharmacist or a medical doctor?
All I know is that I was doing science, and I was even using my mother's stove. Being a community secondary school, I was taking stove from our house to the lab for use. And maybe from that inclination, I was going to come out with something that is basically scientific. So I had medicine in mind, pharmacy, and I ended up becoming a pharmacist.
All herbal medicines, even orthodox medicines or drugs, they all come from plants. Or some of them, recently we discovered that some of them are coming from, some chemical or somehow like that, which a lot of people distaste it, that they don't like it. But from history, as you were giving us about phyto earlier definitions, we knew that all basic medicines come from plants,
Yeah.
from fruit, from the bark of tree, from leaves, and leaves are branches, let's call it that way. They all come from there. But at a certain time, you decided that you want to go into the study of herbal medicine. They tell us what led you to that. The reason I'm asking is that, there are sometimes something occur to you, down the line in professional career, in life. You say, listen, there's a need for more people to either there's a mixture or move away to a certain, medical that can, address, since we knew that they are from plants, let go herbal. Something might have motivated you to do that.
I understand what you are trying to say.
Yes.
As a student pharmacist in ABU's area, 79-80 session, we were following WHO, who was very critical of modern medicine, that in no time, modern medicine was going to give way to natural medicine. Because initially, all medicines came from plants. But in an attempt to mass produce them, there was a need to study their structures in the lab to enable them mass produce them. That is why most of the materials got studied in the lab. And then they got their structures. It is that their structures now they started working on to mass produce them chemically. And in an attempt to do that, some of them, they didn't get their structures well. And that is what has led to side effects. So based on WHO's projections that modern medicine was going to give way to natural medicine, that encouraged me to be biased towards natural medicine right from my graduation. So when I ended up doing my NYSC in Kaduna, and then I passed my exam to Federal Civil Service the same year, it now occurred to me that I reported in the State House Clinic, and by 80-81, HIV/AIDS broke out, and they said they should use AZT, which is a chemical. And while I was graduating, we were told that we should not use chemicals that have too much side effects compared to the work they are doing. And AZT is one of them. In HIV, AZT has far-reaching side effects. The first chemical to be used in HIV/AIDS.
Yes.
So I decided to look for a cure for HIV using natural medicine. And to God be the glory today, I cure HIV using the natural method.
Fam,
Yeah.
let me ask you this. I don't know whether there are, some more, I don't know, when maybe the Kogi East, people from Kogi East, and by Igala extraction. I don't know whether something has motivated them, because you're one of the three persons I know. There was another immunologist, Dr. Balaka, and there was another, it's not a pharmacist, it's Jacob Abdullahi.
Blessed memory.
Blessed memory.
Yeah.
Three of you guys were very, very important. And they are that time I've not even heard about you, that you research into herbal medicine. And everybody, they were talking about him, Balaka, and everybody, then the other one is a laboratory person. How is it that you people are very, you have interest in herbal, the Ingala extractions? I don't know why. How do you guys have this zeal in pursuing these herbal medicines?
If it has been desired by God that certain things should happen,
yes,
there's nothing anybody can do about it. Like in the class, we're about 60. Nobody talk about herbal medicine. I'm the only one in my class till date doing my own research. So I think it's ordained by God that in certain person's life, certain things must happen. And in my own case, it happened that the herbal medicine research. As I will always say, to God be the glory, the extent I've reached so far.
Let's fast track this. You caught the attention of Africa this week when I watch you on social media talk about the cures for various ailments, especially communicable diseases like HIV, COVID-19, even I don't think even malaria. Malaria is just communicable, yes. If the vectors can transfer from me to the other person.
It's a communicable disease.
Yeah, so I saw all these things. Then recently you're talking about COVID-19. Then what is the most obvious one at the moment you are talking about? Most of them that you can cure them. And I'm wondering, whenever he talks about this, and people become amazed, the sickness, especially HIV, people are hiding. They go to the hospitals, they are tired of the medicine they are taking very frequently, and some people came out, they say they are healed. You came out, you say that you have cured some people, and people are becoming exciting. The day I saw you, you were talking about this, and I was like, okay, I've heard about this several times, even in terms of your participating enlightenment and the treatment of individuals that are very sick, from this, facing this calamity. And when you talk about it, how do you have support to do this? Do you have support from, the government, or because there are challenges for you to take care of this? So what are the challenges you are experiencing? To get this done.
There are so many challenges, but life must go on. We're not getting the level of support that we expect in view of these huge breakthroughs we have had compared to other people from different countries. We have not got that level of support. But that will not deter somebody like me.
Yeah.
The research continues.
Tell us about the organization African something when you're introducing yourself earlier.
Yes.
What's the name
I
again?
have floated African Alternative Medicines Only Hospital, where we treat communicable and non-communicable diseases without operation. If you have been following WHO recently, non-communicable disease has been a huge problem all over the world, apart from the bubonic death, the COVID-19, the Zika virus, the Ebola, and co. Another great issue in the world is non-communicable diseases, which are diseases which we age into while we're on this earth. Hypertension, diabetics, a large heart, stroke, chronic kidney disease, asthma, arthritis, ulcer. These are the gamut of diseases referred to as non-communicable diseases. In 2008, WHO said 51 million people died. Out of it, 36 million was due to non-communicable disease. This year alone, it has jumped by 10% to 41 million from 36. And it has led to the death of 74% of the deaths in the whole world is due to communicable disease. That is number one cause of death in the entire world, is non-communicable disease. And in my 37 years of research, I have gone through all of them with far-reaching results, to the extent that we can now reverse kidney failure. Kidney failure. We can reverse it.
It's killing many people these days.
Yes.
Especially the young ones.
Yes. And let me tell you how kidney disease comes about. Those who have hypertension, those who have diabetes, or have both of them together, hepatitis, HIV, even corona and Zika virus, 10% of them end up with kidney end disease. And we have researched into what material can be given to those people so that they do not end up in kidney end disease. Can you see that?
Yes.
A journalist who was diagnosed of kidney end disease went to Wawalada, and he was told that he's going to do 3 dialysis every week, and he should be prepared with 20 million to go to India. To God be the glory. He came and left his paper here, and I treated him. He didn't go for the dialysis again, and he didn't go to India. To the extent that the day his doctor ran into him, he said, Mr. George, he's a journalist. Are you the one? He said, he's the one. You mean you are walking on your legs? You didn't go to India and you have not died? He said, no, my friend treated me. George is alive till today. He followed me to Aso Radio the other day to give an interview. And he's the kind of person, I can give his number to you. You call him, he will give you a live interview on phone if you want to be joined here. And then people with breast cancer that we have cured. And several of them. So the non-communicable disease is a huge problem. As I told you, 74% of the death this year is due to non-communicable disease. 86% of this death happen in low-level countries of the world, which includes Africa, Asia, and some other places. As I speak to you, cardiovascular disease is now 17.9 million deaths in the whole world. Cancer, 9.3 million. Respiratory disease, 4.3 million. Diabetes and kidney, 2 million. It's huge. So we have to do something urgently. And the thing is going to increase more and more.
What I always wonder sometimes is that continuously taking medications, like I hinted earlier, continuously taking medications by those people who are like diabetes and so on and so forth. You ask a doctor, why am I continuing taking medicine? They say, are you not eating food? You say, I'm eating food. And I've heard you that you talk about food being the health or the importance of food into medicines, into the health of human beings. And you talk about it, that it's very important.
The food has to be modified. It's not just food. Not just one sitting down eating Abuja anyhow. It has to be a food that is balanced in all respect of fat, carbohydrate, vitamins, flavonoids, all the classes.
Do you need to have money to be able to handle this?
No. If you decide to eat little of everything, not because your wife's food is too sweet, you consume a full pack of ojabacha from morning to night. You must take little of everything. Balance it with vegetables. Balance it with fruits. Do your exercise, and you are good to go.
I had conversation with you during the via telephone. We've spoken several times, and you told me there's a project you have now.
West of Abuja. Only last week, I think I have just been appointed as Director, Institute of Natural Medicine, Office of the Vice Chancellor in West of Abuja. By my letter of appointment, I am to research into all diseases in the world and using WHO guideline, teach it to the entire world. Based on that, I wrote recently, and the VC approved a diploma program using my concept to teach complementary and alternative medicine at diploma level to the world.
So you are going to get foreign students come and visit the university.
Yes, and we just inaugurated it last week. The importance of that is that this is one of the first university to have such a program. I can recall I met a director about 2 years ago, and he told me his lamentation. He wanted his daughter to read herbal medicine. He said he went online all over the world. He couldn't get a place except South Korea, which says 7 years. And he said, with the happening in the world, he cannot let his child to go to somewhere like South Korea to spend 7 years.
Are you happy that the young graduates now from pharmaceutical schools or university studying pharmacy, they are getting interested in herbal medicines? In those days, there are some doctors now. You come to the hospital, and they prescribe medicine for you, and you tell them you want to be frank with your physician. And you tell him, endocrinologist, this and that. Well, I'm taking this medicine in an alternative medicine that I'm taking this, and they say, why are you doing that? Even some of them, they will refuse to prescribe medicine for you if you dare do that again. I mean, I don't know, but we have seen young pharmacists now. I know a lady, my friend's wife, who is now, is a pharmacist. And she's doing her housemanship now, and she's so much interested in herbal medicine.
That is the way. That is the way to go. So. Forget about those who are sitting on the fence. They are just sitting on the fence. Doctors don't manufacture drugs. It's pharmacists that manufacture drugs, and 70% of the drugs we are using today correlates with their folklore medicine. 70% in any exam is grade A. 70% of the drugs that are in use today in modern medicine correlates directly with their folklore use. And that's what WHO says. WHO says all countries of the world, after it has gone around the 7 continents of the world, and found out that over 80% of the world population depended on their folklore medicine. It now said, the remaining part of the world, go and study and dust off your folklore medicines. That those things are working. And what do you need to do? You subject them to 2 tests. Are these things helpful for human consumption? If the answer is no, go ahead. Can this thing be formulated into products? Go ahead. Even the most important requirement that it must be effective for what you are using for, they did not even emphasize on that. So, if anybody says he or she objects to the use of herbal medicine, that person is on his own. As I speak with you, Canada, US have totally gone herbal. And it's on record that a patient who had cancer of the lungs in the US was not responding. It was my own drug that was taken from here to the US, tested and found to cure 2 cancers, colon and lungs, that I dispensed to the person. And I pleaded with her, please, madam, this drug works. Don't think because it comes from Africa. And she said she's determined to do that. After 4 months of use, she went to do her test. After scanning, the doctor said, madam, I have done your scan. I cannot find any cancer cells in your lungs anymore.
It's incredible.
And that is the end of the story. So to that extent, the federal government of Nigeria had given me a letter to say, hey, you are a pharmacist doing research on cancer that we know. Go to Cuba. We heard that Cuba has discovered a cure for cancer coming from the stink of a scorpion.
Yeah.
Go and understudy them.
Yeah.
I didn't go. I sent 2 of my staff, and they went with my samples. Cuba used them, and Cuba signed an MOU for a 2-day program. They signed an MOU, the state of Cuba, with Halamin Herbal, for them to represent me there, and I represent them here. And
this is incredible.
after they sent me, 5 years later, I now discovered my own cure for cancer that has 89 to 90%. And the same federal government is looking like this, looking the other way. After American scientists came here, took the drugs, and concurred that Ben's drug cures cancer. So, pharmacist, barrister, Ben Amodu, I am not discouraged.
Let's talk about your law degrees. But first of all, let me finish with let me finish what I have at hand here. First of all, I remember I've listened to you or read from you. You talk about efficacy.
Yeah.
As one of the challenges of the herbal medicine. Tell us about this, because that efficacy. No. Because if I go to the village, sometimes I get medicine. I just wonder what am I taking here, and I just say, let me give
my explanation to you. My explanation to you about
efficacy. What is that problem
with
that efficacy of medicine?
No. I'm only saying that a drug have no side effects must also be in a form that you can formulate into medicine, and I also say it should be efficacious. It's a requirement. But I'm only saying that WHO does not even care about that aspect of efficacious. Let the material have no side effects, that people can take it without going to contact another disease. 2, that it is in a form that it can be put either in liquid form or in solid form for people to take. But that the most important for many people is it efficacious? WHO did not even consider it, while saying you should go to your folklore medicine. And it was based on this requirement I went into this research, and to God be the glory. You can see me with the Vice President of the Federal Republic of Nigeria. I'm talking to him about my Submal, which is an anti-malaria, which I discovered about 15 years ago. This product has the capacity, it has 97% effectiveness against P. falciparum, which is the causative agent of malaria. 97%. This product is recorded in the Indian Journal of Medical Research. This is a journal that is 150, 52, 53 years old. It is a high impact journal in the world. So we follow the best practice, and we follow this what is required internationally to follow best practice. I discovered a product. We send the documents out. An international journal like Indian Journal of Medical Research in Herbal Medicine is #1 journal in the world as far as medical research is concerned. Recorded, mentioned Abejukolo, where my farm is, described it, and published it. Cannot be anything.
So the farm at Abejukolo contains many plants, different cuisines.
Yes. I grow the raw materials there in the Rift Valley in front of my hotel, and elsewhere you cross the river to go to other affiliates of my farm. And it has been so recorded. So for me, I am not bothered by anybody's comment about herbal medicine. I am convinced, and WHO is convinced, the results we are getting is very high. Very gigantic, as one man recently told me. He said, with gigantic discoveries. Who has discovered a cure for cancer anywhere?
Pharmacist.
Yes.
Ben.
Sorry, when COVID came out, I told government we can prevent and cure this COVID. They look the other way as usual. Today, they are going to the Facebook, seeing my COVID cure all over on the Facebook. A 90-year-old woman, I have not even seen her until I cured her in Gwagwalada Teaching Hospital. She was discovered to have COVID, and the son was feeling very bad until one man saw him. What's the problem? You look bad. He said, no, my mother is dying of COVID in the world. Do you know Ben Amodu? Run to Apo. He came here, and I said, take this drug to Mama. In 5 days, Mama will come out of COVID. In exactly 5 days, Mama was tested COVID negative and discharged. To God be the glory.
Fam, I'm not going to go into your the other field, your barristership as a lawyer. I've read about it. I've heard about it because I read in the United States, and I see a lot of doctors. Some of them are becoming lawyers too, because when they go and defend even medicine, their findings, some of them are being invited over malpractices and others. Fellow doctors or pharmacists or medicine man who is also a lawyer represents them. So I'm not going to find it very strange that you're also, a lawyer. I thank you very much to come to Africa this week.
Thank you.
To speak to us.
Thank you.
On your findings, your endeavor, your commitment to herbal medicine and research and the dignity of human being as enunciated in the medical or World Health Organizations in terms of one's well-being. Thank you very much.
Thank you.
For coming to Africa this week.
Thank you.
And we will do this once more again. We'll continue to see that the federal government of this country drop out or by the wayside of bureaucracy.
Thank you.
In terms of,
Thank you.
you're a fine man, sir.
Thank you.
Thank you very much. We appreciate it, sir.
Thank you.
Yes. Well, thank you very much for watching. I've been talking with pharmacist Ben Amodu, a researcher into herbal medicine, very enduring individuals. He's also a barrister. I thank you very much for coming to Africa this week to speak to us. Join me next week as more African events unfold. Abubakar, Sadiq, Ibrahim.